Hello everyone, my name is Hani Eliwi and I work with the Refugee Resettlement Program in Ireland. Today I'm going to talk about the health services available to refugees in Ireland, how you can register with a GP, and how access the medical care in the country. First of all, I would like to thank the four of you who are joining my Zoom meeting. I sent the link to you earlier. Thank you very much for joining, and I hope everyone is hearing me clearly. Thank you very much for confirming that. Imagine arriving in a new country as a refugee. You might not know where to go when you are feeling unwell or how to see a doctor or even get medicine. That can feel not good, right? But by the end of this season, you will understand the following things. First of all, how the Irish healthcare system works. Second one, how to register with a GP. And then the third one, how to get a medical card. And the fourth one, how to book appointments and access services. And the fifth one, some mental health supports available. Okay, so I'm going through all of that today, 5 steps. We will use different learning methods today. I'll explain, we will have a short discussion, and I'll show you some practical examples. Feel free to ask questions at any time. Okay, so here's the first question for you guys, just to understand what information or what knowledge do you have about the health system here in the country. So the first question to you, can anyone guess what is the GP stands for? Well done, Abdul. GP stands for general practitioner. Your local doctor for most health concern. That's what they call it here in the country or in Ireland, is a GP. There's another question for you. Have any of you ever tried to see a doctor in Ireland before? Well, so one of them, he said yes, and then the rest they said no. No problem. Today I will go step by step so it becomes easy for everyone to understand how to see a doctor in the country. Okay, so the first thing I'm going to talk about is the health services in Ireland. The health services in Ireland is the main provider of the public health service in Ireland. They call it Health Service Executive, or what they call it HSE. And the HSE runs hospitals, clinics, community health services across the country. Okay? So HSE stands for Health Service Executive. And this is what we call it here, in short, in Ireland, HSE, and it runs hospitals, clinics, and community health services across the country. As a refugee, under the resettlement program, you are entitled to access to access the public health service, just like anyone else. This includes seeing a GP, attending hospital, and getting treatment for illnesses. Okay, is that understandable now? Good. So here's a question for you. Can anyone name a service provided by the HSE? Well done. So the HSE provided many services, including hospitals, GP clinics, community health services, vaccination program, mental health support, extra, extra, extra. Well done, well done, well done. Next part I'm going to talk about is the medical card. And the medical card is one of the most important things for refugees, is the medical card. So one of the most important things for the refugees is the medical card. Why is that? If you just see what I'm sharing with you, is everyone able to read what I'm sharing with you now? Well done. Okay, good, good, good. So first of all, the medical card allows you to access GP services and many other health services free of charge. So you need to understand that once you have medical card, you are able to go to the GP services, many medical services, and free of charge. It covers the GP visits, medications, public health treatments, and some dental and optical services. Okay, so you are able to go to the, for example, to the optician to do the test free of charge once every 2 years. At the minute, it's once every 2 years. Refugees under resettlement program are usually eligible to get medical card. Okay, next one. You can apply for the medical card. Everyone can apply for medical card online or in person through the hse.ie. There's a website called www.hse.ie, and you will need to provide your PPS number and proof of residency. Okay, you need to provide them when you apply for a medical card. Is everything clear now? Thank you very much. So here's a question for you guys. What is the medical card and who can get it? Well done. So medical cards allows you to access to free healthcare, and refugees under resettlement program usually eligible to get medical cards. Well done. There's another question for you now, guys. And the next question is, what happens if someone doesn't have a medical card? If one of you doesn't have medical cards, what happens to them? Say that again. Yeah, kind of, but I'm going to give you the full answer about that. They might have to pay for GP visits or medicines. Some services might still be free, but it's harder to access care without the medical card. You need to understand, if you don't have medical card, you have to pay for the GP visits, for the medication, and dental. So yeah, you need to pay for that if you don't have medical card. Okay, so once you get your medical card, okay, you need to register with a GP. And now let's talk about registering with a GP, which is really important for getting healthcare in Ireland. So the steps is, number one, you need to find your GP. The GP needs to be near you. You can search online, okay, for a GP, or ask community support services. Second thing, or second step, you need to contact the GP's office by phone or email. Email them, give them a call, ask them that I need to register with you. Are you accepting new pensions? 3, you need to provide your PPS number and medical card if you have one. Okay, so if you are moving address, you need to register with a new GP, but you have a medical card, you need to give that medical card to your new GP, and plus you need to give them your PPS number. Usually the medical card, there is a PPS number written on them. And then the last one, fill out the registration form. Some GPs might ask you for ID or proof of address, okay, to complete the registration with them. Is everyone understanding this? Well done. Is there any question? Good. So here's a question for you. I know most of you are coming from Syria, so imagine a family from Syria has just arrived. What should be their first step to get healthcare? Good. So the first step should be register with a GP. Once registers, they can book an appointment and get prescription. Good. Let me check on this, and there's another question as well, very important question, just to cover what I said to you. What documents do you need to register with a GP? Can someone answer me what documents you need to register with a GP? Say that again. Good, 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 good. So you need your PPS number, medical card if you have one, proof of address, and a proof of ID. Great. Well done. Well done. Well done. So once you have your medical card, you are registering with a GP, then I'm going to talk to you about how to book appointments. And booking a medical appointments in Ireland can be done in several ways. Okay, if you need to book an appointment, you have some options. So the first option is by phone. Call the GP clinic and ask them for, or speak to the receptionist. Ask them for an appointment. Speak to the receptionist. Ask her or ask them for an appointment. Or in person, you need to go in person to the clinic, to the GP clinic, and ask them for an appointment. Some GPs now, they provide in online appointments. So you need to book your appointment through their websites. You need to search online for your GP, click on their website, and then you click on making an appointment. And then after that, you just put the details, fill in the details, your name, surname, date of birth, PPS number. They might ask you about some symptoms, and then submit that, your phone number as well, and then they will contact you to make an appointment. But if it's emergency, if you have an emergency situation or emergency case, you need to go to the emergency department, or what they call it here in Ireland, A&E. And that's in your nearest hospital. You need to search your nearest A&E or emergency department and go to them. For non-urgent cases, your GP is the first point to contact. So you need to contact your GP if it's not urgent. If it's urgent, you need to go to A&E and to the hospital. Okay, so here's a question for you guys. How can you book an appointment with a GP? Can someone answer me? How can you book an appointment with your GP? Good. So by phone, in person, or online if available. Great. There's another question is, if someone feels very unwell at night, okay? If someone feels unwell at night, what should they do? Good. So go to the emergency department in your nearest hospital. That's correct. Or call 999 or 111. 112, 1112 or 999 in urgent situation. That's great. So the last one I'm going to talk about is the mental health services. Mental health is very important, especially for refugees who might have experience of trauma. Okay, experience trauma. Mental health is very important for you guys. Your GP can refer you to a mental health services, including counseling or therapy. Some NGOs and community organizations provide extra support for refugees, like Spirasi in Dublin 7. If anyone wants their contact details, I'll pass that on after this. And is that everything? That's everything about the mental health services. Is that everything clear to you now, guys? Okay, so there's a question for you. Why is mental health important for refugees? Good. Because many refugees have experienced trauma or stress, and mental health affects both well-being and ability to settle in Ireland. Good, good, good. There's another question here for you guys. How can we support friends or family who feel stress or anxiety? Yes, 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 that's true, that's true, that's true. So listen to them, encourage visiting a GP or counselor, and guide them to community support services. Great, great, that's great, well done. So to summarize about what we talked about our topic today, I'm just going to summarize what we went through. First of all, the HSE provides public health services in Ireland. And refugees can apply for a medical card, and registering with a GP is very important. And then appointments can be booked by phone, online, or in person. And then mental health services are available and important for everyone, including refugees. Now, I'm just going to ask you a question. Can someone summarize the steps to see a doctor in Ireland? Yeah, apply for a medical card, register with a GP, book an appointment, and attend or go to the A&E if it's urgent. And then the next one is, what is the one thing that you learned today will help you in Ireland? I want you to write that to me and send it to me, please. Thank you for your attention. I hope you feel more confident about accessing health services in Ireland. And thank you very much. Thanks all. Thank you.